I'm surgical oncologist, and during ESMO, sarcoma and rare cancers, we had a discussion with my colleague Alex Gronki about the unplanned excision. Oops operation, this is disaster which can happen when the diagnostic biopsy in soft tissue mass was not performed, and sarcoma was not diagnosed before surgery. So unplanned surgery was performed. In this situation, usually we have positive margins, and it's very difficult to reassess the patient after such approach. So what are the consequences of R1 or unplanned excision? Of course, we can have a local relapse. We can have distance mets first before the local relapse, and local relapse plus distance metastasis. It means that we have to discuss in multidisciplinary team how to approach to the situation when we have this unplanned excision. We know that unplanned excision is related to the higher risk of local relapse, but the effect on overall survival, it's not so evident. However, we know that on many systematic reviews and meta-analyses, we know that we can highlight that optimal oncological outcome can be achieved in patients who underwent resection of the scar after non-radical resection. It's not always easy to perform because usually this surgery is much more complicated than primary could be. Moreover, usually we should combine it with pre-operative treatment, at least radiotherapy. So I am strongly in favor to discuss with patients the systematic resection after unplanned excision of soft tissue sarcoma. And it still seems to be the gold standard in care of this patient. Nevertheless, not always it's of course possible. And we should definitely focus on this kind of tumors which have infiltrative nature, like myxofibrosarcomas or the dermatofibrosarcoma protuberans. Because positivity in this situation is almost 100% related to the local relapses. Of course, that patients who are referred after unplanned excision usually tend to have smaller superficial tumors because it's much easier to re-excise such patients. And when we have such clinical situation, usually the patient should be treated in an aggressive way, as I mentioned, pre-operative radiotherapy plus surgery, sometimes also chemotherapy, what is also related to higher morbidity and should be very well balanced with the patients. Nevertheless, the results which we have indicate that radical re-excision of scar after non-radical primary tumor resection plus radiotherapy seems to improve disease-free survival, local relapse-free survival, at least in some subtypes of soft tissue sarcomas. And the patient can still be salvaged with good final outcome when referred to sarcoma unit. So R0 resection and multidisciplinary care in tertiary referral center is crucial in such situation. So this is what we have discussed. We haven't any prospective clinical trial, of course, comparing systematic resection and watch and wait approach. However, in the routine way, usually we always consider to treat the patients after unplanned surgery.